You are listening to A Path to a New You, a podcast about mental health and veterans issues. I'm your host, Timothy Zaromsky. I am a therapist located in Madison, Wisconsin. I am a veteran. I served in the United States Navy from 2001 to 2009. You can find this podcast currently on Spotify, Apple Podcasts, and now Google Podcasts. And hopefully soon there'll be other platforms too. I just got to work on it. I have a Facebook page called A Path to New You where I will post information and self care and other veteran and mental health information, as well as a link to this podcast. So if you don't have the podcast available, you can just click on there. Please like and follow the Facebook page A Path to New You. I would really appreciate it. The more people who follow, the more who listen, the more people I can talk to, the more people I can educate on mental health and veterans issues. This podcast is sponsored by New Beginnings Counseling LLC, a veteran owned private practice. They currently see patients via Zoom, and within the next couple months, they'll be doing in person as well as Zoom. So it'll be like a 50-50. They do not have a wait list. They currently are private pay and will work with you if you can't afford what they charge. We do have it's called a sliding scale. They specialize in anger management, PTSD, depression, anxiety, and addiction. You can call or text them at 608 571 3896 if you want to set up an appointment, a session, or you have questions. Again, that number is 608 571 3896. New Beginnings Counseling LLC also has a Facebook page. If you'd like to, you can follow and like that as well, where I post mental health information, self-care, and interesting topics that could be current events related to veteran issues or mental health issues. So this podcast, like I mentioned before, is about mental health and veterans issues. I try to do an episode at least one a week, at least every week. Sometimes, depending how busy I am, it might be every other week or once a month. But lately, it's been about a week. So I try to do an episode a week. There are different topics related to mental health and veterans issues. I also have guests on this show. I had one last week, which was a really interesting guest, and she was extremely informative. And so far, those who have listened to it said she was extremely informative, informative, and they really enjoyed that episode. So, if you know anyone who either works in the mental health field, who's a veteran, or you yourself are a veteran, or you work in the mental health field, and you'd like to be a guest on my show, please contact me either through my Facebook page, A Path to New You, or you can text me again or call me at 608 571 3896. I really like to have more guests on this show. I have one coming up in November and another guest in January, but I'd like to have more guests more often. You know, I can talk all I could talk a lot, but it'd be really nice to have someone else on this show who specializes in a certain topic, who knows more about a topic than I do. Anyway, again, you are listening to A Path to a New You, a podcast about mental health and veterans issues. So today's topic I want to talk about is addiction, recovery, and talk a little about treatments. September is Addiction Recovery Awareness Month, so it's one of the reasons why I want to talk about it. It is also Suicide Awareness Month too, and it's a few other known topics too for the month of September. But those are the ones I've talked about in the last episode, 2 episodes ago, where I talked about Suicide Awareness Month. So today I want to talk about addiction, recovery, and treatment. So again, I found a lot of my information online, and I kind of do my research a little bit. So people with addiction lose control over their actions. They crave and seek out either drugs, alcohol, or other substances, no matter what the cost, even at the risk of damaging friendships, hurting family, or losing jobs. Research has shown that addiction is a long lasting and complex brain disease, and that current treatments can help people control their addictions. But even for those who successfully quit, there's always a risk of the addiction returning, which is called relapse. I actually work with clients who have addiction, and some of them have gone through relapse. They get frustrated, like, you know, I've been sober for this amount of time. Something happened where I got triggered and decided to use again. I tell them it's about the process. It's a whole process. So don't get too hard on yourself. If I tell them, don't get too hard on yourself if you relapse. It's okay. It tends to happen. It happens. Something triggers it. I'll talk a little bit about more of that about that later on. So a common misperception that I've been hearing quite a bit about last for a while now from some people is that addiction is a choice or moral problem, and all they have to do is stop. But that is not true. That is certainly is not true. When people use, the brain actually changes with when they're using. It takes a good deal of work to get it back to normal state. So once people come addict, someone comes addicted to certain alcohol, drugs, or whatever, it takes a while for it to get back for the brain to get back to where it was prior to the addiction. So it's disease. So it is not a choice. It is not a moral problem. And I've actually called people out on that. So the more drugs or alcohol or substance someone's taken, the more disruptive it is to their brain. So a healthy brain rewards healthy behaviors like exercising, eating, hanging out with people, family, loved ones. It does this by switching on brain circuits that make you feel wonderful, which then motivates you to repeat those behaviors. But when you're becoming addicted to a substance, the normal hardwiring of the healthy brain process can begin to work against you. Drugs or alcohol can quote unquote hijack the pleasure slash reward circuits in your brain and hook into you wanting more and more. Addiction can also send you emotional danger sense circuits into overdrive, making you feel anxious and stressed when you're not using the drugs or alcohol. So at this stage, people often use drugs or alcohol to keep them from feeling bad rather than for their pleasurable effects. If that makes sense, that's to add to that, repeated use of drugs can damage the essential decision making center at the front of the brain. That area is known as a prefrontal cortex. It is the very region that should help you recognize the harms of using addictive substances. So again, you get to repeat it over time of using substance, alcohol, drugs. and it will eventually damage the prefrontal cortex, which is the region of your brain which should help you recognize the harms of using addictive drugs. Addiction tends to run in families, and certain types of genes that have been linked to different forms of addiction. But not all members of an affected family are necessarily prone to addiction. For example, heart disease and diabetes, there's no one gene that makes you vulnerable. Other factors also raise your chances of addiction. Growing up with an alcoholic, being abused as a child, being exposed to extraordinary stress, all of these social factors could contribute to the risk of alcohol addiction or drug use. Teens are especially vulnerable to possible addiction because their brains are not fully developed, particularly the frontal regions that help with impulse control and assessing risk. Pleasure circuits in adolescent brains are also operating in overdrive, making drug and alcohol use even more rewarding and enticing. There are some warning signs of addiction. Some of the warning signs can be sleep difficulties, anxiety or depression, memory problems, mood swings such as temper flare ups, irritability, and defensiveness, rapid increase in the amount of medication needed, frequent requests for refills of certain medications. So someone keeps using that for their addiction and they keep going in and asking for refills of their medications. A person not seeming like themselves, showing a general lack of interest of being overly energetic. Doctor shopping because one doctor is not allowing them not filling their prescriptions, or they're finding someone else to increase their prescription refills. The use of more than one pharmacy and false or forged subscriptions. So they'll go out and fake a signature, like their doctor's signature, in order to get that refill if they're addicted to prescription drugs. And now I want to talk about the treatment and recovery part. I also have some interesting statistics I want to talk about later on in this podcast, in this episode. So, addiction is a treatable disorder. Research on the science of addiction and the treatment of substance use disorders has led to the development of research based methods that help people to stop using drugs and resume productive lives, which is also known as the recovery. Like treatment for other chronic diseases such as heart disease or asthma, addiction treatment is not a cure, but a way of managing the condition. Treatment enables people to counteract addiction's disruptive effects on their brain and behavior and regain control of their lives. So I mentioned relapse. So someone might ask, or some of my clients who have been in relapse, like, you know what, I failed, treatment failed because I relapsed. That's not true. The chronic nature of addiction means that for some people's relapse or a return to drug use after an attempt to stop can be part of the process. And I always mention to people who I work with, who are my clients, that's part of the process. Relapse might happen. It could possibly happen. There's a chance it could happen. I always tell them, even on the first session, I tell them, relapse is it's a possibility you might go into relapse. Someone might trigger it where you might go into relapse. And that's where I work with them so they can find coping skills and other things to do so that they don't go into relapse. Like I just mentioned, some newer treatments are designed to help with relapse prevention. Relapse rates for drug use are similar to rates for other chronic medical illnesses. If people stop following their medical treatment plan, they are likely to relapse. So that's another part of the whole counseling thing or therapy is the treatment plan. Treatment plans used to help. It's it's meant for that one person I'm working with, that person I'm working with, so that relapse does not happen. Treatment of chronic diseases involves changing deeply rooted behaviors, and relapse doesn't mean treatment has failed. When a person recovering from an addiction relapses, it indicates that the person needs to speak with their doctor to resume treatment, modify the treatment, or even try another treatment. So every 3 months or so, that's when I usually update the treatment plan and try to figure out where they're at, what goals they're trying to achieve, and then like a treatment plan is updated every couple of months. I try to do it every 3 months, if not every two. Research shows that when treatments addictions to opioids like prescription pain relievers or drugs like heroin or fentanyl, medications could be the first line of treatment, usually combined with some sort of behavioral therapy or counseling. Medications are also available to help addiction to alcohol and nicotine. Additionally, medications are used to help people detoxify from drugs. Although detoxification is not the same as treatment, it is not sufficient to help a person recover. Detoxification alone without subsequent treatment generally leads to resumption of drug use. For people with addictions such as stimulants or cannabis, no medications are currently available to assist in treatment. So, treatment consists of behavioral therapies. Treatment should be tailored to address each patient's drug use patterns and drug related medical, mental, and social problems. So, what medications and devices help treat drug addiction? I'm going to talk about a few of them. Treating there's withdrawals. So, treating withdrawals when patients first stop using, especially if they've been using a lot or a bit hardcore, and all of a sudden they stop using. That's where withdrawal comes in. They can experience various physical and emotional symptoms, including restlessness, sleeplessness, as well as depression, anxiety, and other mental health conditions. Certain treatment medications and devices reduce these symptoms, which make it easier to stop the drug use. I've worked in inpatient settings where seeing clients go through withdrawals and they are restless, they're sleepless, and their beds sheets are soaked in sweat because they've been using for so long and so much for so long where all of a sudden they stop using and the body's like, what's going on? This is something's going on here. And yeah, it does not look good. And they feel like crap. Let me tell you that right now. Another thing that patients or people should do if they're in treatment, they need to stay in treatment. Some treatment medications and mobile applications are used to help the brain adapt gradually to the absence of drugs. These treatments act slowly to help prevent drug cravings and have a calming effect on body symptoms. They can help patients focus on counseling and other psychotherapies related to their drug treatment. So they need to stay in treatment. It's not like, oh, they go to a couple sessions and then they're done and then they just stop. They need to continue to stay in treatment. Scientists have taught us that stress cues linked to the drug use, such as people, places, things, and moods and contact. with drugs are the most common triggers for relapse. Scientists have been developing therapies to interfere with these triggers to help patients stay and recover. So with my patients, I we talk about maybe upcoming anniversaries, holidays, something that might come up like work related, anything that could be a trigger to a relapse. And so we work ahead of time to figure out what we can do to prevent relapse. Um, some of it has to do with the people they hang out with. Another one could be an app that they've always gone into. I heard Telegram is it's a common app where drug dealers will use to work with their people who buy the drugs from them. And I there's clients in the past who've used Telegram so they can buy it easier from their drug dealers. So Telegram is the most common one. Another one too is WhatsApp. Yeah, those are a few common apps that are used by drug dealers. There's some common medications that can be used to treat addiction and withdrawal. For opioid addiction, there's methadone. That's pretty common. Extended release naltrexone. For someone who's addicted to nicotine, there's nicotine replacement therapies such as a patch, inhaler, or gum. So those who are trying to quit smoking cigarettes, sometimes they'll use a patch or gum to help stop the cravings, or they'll use it they'll use it for their replacement of smoking, and eventually they'll taper off to the point where they don't even need it anymore. Bupropion is another common one for nicotine. For alcohol, it's naltrexone is one of the most common ones. And then you have the behavioral therapies that can treat drug addiction. One of the most common ones that most therapists who are addiction counselors use is cognitive behavioral therapy. Cognitive behavioral therapy seeks to help patients recognize, avoid, and cope with the situations in which they're most likely to use their drugs. There's contingency management, uses positive reinforcement such as providing rewards or privileges for remaining drug free, for attending and participating in counseling sessions, or for taking treatment medications as prescribed. I think the contingency management would be more used for someone who's in um in housing for their addiction. My mind's just been playing. I know what it's called, the housing's called, but for someone who's in like a long-term facility, maybe not long term, maybe short term, like a 60-day place where they stay for their recovery, and they stay there. That's where therapy, they do their sessions, group sessions, and stuff like that. Um, Residential. That's what I'm thinking about. It's a residential facility where they stay, I guess, between 30 to 90 days, and that is where they stay and they continue to get treatment daily, and they attend group sessions, and they'll do activities with group activities and stuff. I guess that's what I'm trying to get at. They're residential facilities. I'll talk more about that type of treatment in a different episode where I'll talk about more the different types of treatment. Motivational enhancement therapy uses strategies to make the most of people's readiness to change in their behavior and enter treatment. Family therapy, and now family therapy is another big one. Family therapy helps people, especially the younger people, with drug use problems, as well as their families, address influences on drug use patterns, improve overall family functioning. So I worked at a for a nonprofit. They were mainly intense. Um, they were group. It was a group setting, and every couple of weeks or every week there would be a family therapy session with that client's family, and we'd educate them on how to help their son, their child, their daughter, help them maintain sobriety, and kind of educate them on what they can do to help. And then again, there's a 12-step facilitation, TSF for short, is individual therapy typically delivered in 12 weekly sessions to prepare people to become engaged in 12-step mutual support programs. 12-step programs like Alcohol Anonymous are not medical treatments but provide social and complementary support to those treatments. TSF follows the 12-step theme of acceptance, surrender, and active involvement in recovery. So, the last thing I want to talk about in this episode, I want to talk about some addiction statistics. Found these online, and they're kind of up to date. They're from like 2017, but this article is updated in 2023. So I don't know how often they update the percentage and all that stuff for these statistics. But anyway, again, this is from all from like 2017. About 30% of adults in 2017 battled an illicit drug use disorder. That same year, one of every eight adults struggled with both alcohol and drugs use disorders simultaneously. In 2017, 8.5 million American adults suffered from both a mental health disorder and a substance use disorder, or what's also called a co-concurrent occurring disorder. So that's another interesting fact is a lot of people will use substances as alcohol, drugs to self-medicate for their mental health issues that they're having, and then eventually it all becomes two different things that they need to work on when they go to treatment instead of that one. Now with all these clinics and private practices have these wait lists. People are trying to figure out what they can do to help manage their mental health. So a lot of them don't know about these coping skills, and so they use alcohol and drugs to help cope with their mental health issues. And then, like I mentioned, they become addicted to alcohol or drugs or even both. Drug abuse and addiction cost American society more than $740 billion annually in lost workplace productivity, healthcare expenses, and crime related costs. Genetics, including the impact of one's environment on gene impression, account for about 40 to 60% of a person's risk of addiction. Environmental factors that may increase a person's risk of addiction include a chaotic home environment and abuse, parents' drug use and attitude toward drugs, peer influences. Peers could be friends. Friends are using, so they start using with their friends. Community a- attitudes toward drugs and poor academic achievement. Teenagers and people with mental health disorders are more at risk for drug use and addiction than other populations. And then I got a few other statistics from adolescents ages 12 to 17. In 2017, approximately 4% of the American adolescent population ages 12 to 17 suffer from a substance use disorder. This equals to about 992,000 teens, or one in 25 people in that age group. About 443,000 adolescents ages 12 to 17 had an alcohol use disorder in 2017. Um, Young adults ages 18 to 25. Again, I'm just going through some statistics here. About 5.1 million young adults ages 18 to 25 battled a substance use disorder in 2017. That number might have gone up a little bit, especially during the pandemic. Some of these statistics might have gone up a little bit because of the pandemic and everybody's at home. They can't do anything, they can't go out, they stay at home. So they may use alcohol more. Actually, that's probably a fact. They probably have used more. About 3.4 million young adults ages 18 to 25 had alcohol use disorder in 2017. About 2.5 million young adults had an illicit drug use disorder in 2017. Heroin use among young adults between 18 and 25 years old doubled in the past decade. For people over 26, approximately 13.6 million adults aged 26 or older struggled with substance use disorder in 2017. About 10.6 million adults ages 26 and older had an alcohol use disorder in 2017. About 4.3 million adults aged 26 or older had illicit drug use disorder in 2017. Men may be more likely to abuse illicit drugs than women, but women may be just as prone to addiction as men when they do abuse them. American Indians and Alaskan Natives aged 12 and older had the highest rate of substance abuse, and dependence in 2017 at 12.8%. About 6.8% of African Americans struggled with substance use disorders, while the percentage of Hispanics or Latinos who suffered from substance use disorders was at 6.6%. Almost twice as many people who are unemployed struggle with addiction than those who are full time workers. Again, let me mention that again. Almost twice as many people who are unemployed struggle with addiction than those who are full time employee workers. Of the 2.3 million people in American prisons and jails, more than 65% meet the criteria for addiction. I'm going to repeat that again. That's kind of an important statistic there. Of the 2.3 million people in American prisons and jails, more than 65% meet the criteria for addiction. Around 75% of individuals in a state prison or local jail who suffer from a mental health illness also struggle with substance abuse. And the opposite is also true. So the opposite is also true, which means the they struggle with substance abuse, and they also struggle with mental health illnesses. So a lot of that goes hand in hand, which means our prison systems are not. There needs to be some addiction treatment in our prisons. Some of the prisons do have counselors and therapists who work with them on those inmates who have addiction, but there needs to be a lot more done for that. And here are some interesting statistics about cocaine and heroin. About 966,000 American adults over age 12 struggled with a cocaine use disorder in 2017. That same year, 637,000 people aged 12 and older received treatment for a cocaine use disorder, either in their last or current stay in rehabilitation. About 652,000 people aged 12 and older had a heroin use disorder in 2017. Almost a quarter of the people who abuse heroin would become addicted to it. Heroin use has risen in most demographic groups in the United States over the past 2 decades. The Center of Disease Control and Prevention have reported. The highest at risk population for heroin addiction is non Hispanic white males between the ages of 18 and 25 who live in large cities. The most common types of prescription drugs abused in 2017 were pain relievers, tranquilizers, stimulants, and sedatives. Women may more rapidly develop a prescription painkiller dependence than men. They are also more likely to have chronic pain, be prescribed pain relievers, and receive higher doses. For marijuana, approximately 4.1 million American adults over the age of 12 battled a marijuana use disorder in 2017. The majority of people struggling with marijuana addiction in 2017 were between the ages of 12 and 25. Almost 6% of full time college students in the United States were daily marijuana smokers in 2014. This is more than triple the number of daily smokers in the population 20 years prior. And looks like we got one more for this is for alcohol. In 2017, an estimated 4.5 million American adults aged 12 and older battled an alcohol use disorder, or that's 5.3% of this population. Over half of all American adults have a family history of problem drinking, or more than 10% of the more than 10% of the US children live with a parent with alcohol problems. An estimated 88,000 people die from alcohol related causes annually. Again, let me repeat that. This number might have gone up too since 2017. An estimated 88,000 people die from alcohol related causes annually. Alcohol is the third leading cause of preventable death in the United States. And there was quite a few different statistics I wanted to share. Hope you got some of them. Those are some really interesting facts, interesting statistics. Again, that was from 2017. I couldn't find anything around 2022 or 2023. I'm sure there's some out there on the internet somewhere. So I'm sure a lot of those numbers have gone up, especially since the pandemic, where more and more people actually drank during the pandemic because majority of them were stuck at home, working from home. Um, yeah, if you I guess you have any questions about what I just talked about, you can always contact me on my Facebook page, A Path to New You. Uh, you can message me there. Again, please like and follow my Facebook page, A Path to New You. I also got a Facebook page for my private practice, New Beginnings Counseling LLC. Please like and follow that Facebook page. I do post information on mental health, self care, veteran related, all kinds of good information on there that might be interesting to you. So please, again, like and follow Path to New You on Facebook. Also, like and follow New Beginnings Counseling LLC on Facebook. Again, if you know anybody or you yourself would like to be a guest on my show, you either work in the mental health field, you work for a nonprofit, Or you could be a veteran yourself and you want to talk about your story, about your struggles while out of the military, or you want to talk about your military life. You and I can discuss our military life here on this podcast. I did that on Veterans Day last year. I might do something towards that for that this Veterans Day. This Veterans Day is on a Saturday. So I might reach out to a few people and see if they'd like to come on my podcast and talk about the military life, especially deployment. You'd be surprised how many people don't realize how about what happens on deployments. And anyway, if you were, like I mentioned, you know someone who wants to be a guest on my show, please have them contact me either through my Facebook page, A Path to New You, or they can contact me at my number 608-571-3896. My mind just went blank for a minute. Have them contact me and we can discuss um, them being on a guest and what they want to talk about. Again, they don't have to come to me. I don't have to come to them. I do use Zoom as my um, for my guests. So I just send them the link, and we can don't have to go anywhere, and we talk over the computer, and we record the podcast episode. Anyway, again, you were listening to A Path to New You. You can find my podcast on Spotify, Apple Podcasts, and Google Podcasts, and hopefully sooner than later on other platforms. I'm trying to work on it. It takes a little time. I'm trying to get it back. I'm trying to get it on Amazon too. Anyway, you're listening to A Path to New You. I hope you learned something today. Again, if you have questions, you can contact me. I'll post this link to this episode on my Facebook pages. And when you click on the link, please like and follow this podcast so that when you follow and I have a new episode up, you'll get a notification. Just click on that bell, which is should be up the upper hand of where the title of the opportunity is. Click on the bell, and you should receive notification every time I have a new episode up. Anyway, the more people who listen, the more I can educate those on mental health and veterans issues. Until next week, have a good rest of the day. Have a good week. Be well. You're listening to A Path to a New You.